I'm Brandon Doucet. I'm a practicing dentist and a founding member of Coalition for Dental Care. I'm here to talk to you today about some of the current trends in dental care in Canada and what we can do to try to make a more humane system. In order to understand the current nature of our dental care system, we need to understand how it's currently structured. And dental care in Canada is structured very similarly to the private American healthcare system. So people rely primarily on work-related benefits and out-of-pocket payments to access dental care. In fact, this accounts for 95% of dental spending, and only 5% of dental spending comes from targeted government programs, which is an even lower amount than the Americans spend on dental care. We have many of the same problems of a private healthcare system because dental care is so privatized. We have high prices, we have lack of standardized pricing, and people who need help the most struggle the most accessing dental care. So to put some numbers to what I'm talking about here, there is over 1 in 3 Canadians that lack any form of dental insurance, and over 1 in 5 that avoid the dentist each year because of financial constraints. What these numbers don't highlight is that of the 1 in 3 who lack dental insurance, there are many more who are underinsured because they have low annual amounts that'll pay out. Also, they have large co-payments and deductibles. These numbers that I'm talking about are on the rise because of changes in the nature of our economy. So there's a lot of older people retiring and losing work-related benefits, and also a lot of younger people working in the precarious gig economy, which does not provide benefits like dental insurance tied to their labor. Without dental insurance, people have to pay for these services out of pocket, which is prohibitive. And this has been increasing before the pandemic. With COVID-19 and the financial crisis that it's caused, these problems have only gotten worse. So people are becoming unemployed and losing their benefits, and they're losing disposable income to pay for these services out of pocket. And there's predictable consequences when people can't afford dental care. Poor oral health can cause or worsen many general health conditions, so heart disease, diabetes, aspiration pneumonia, as well as many other general health conditions can be caused or worsened by poor oral health. And when people can't afford dental care, they're forced that fate upon them. Also, you could imagine it's very difficult to interview for a job or get a job with the public if you have visible dental decay or you're missing front teeth. That can also have effects on your self-esteem. It's also difficult to sleep when you're living with chronic dental pain and infection. All of these things contribute to the cycle of poverty where it's so hard for people to get out because the longer they wait, problems only get worse. So small cavities are left to grow and to the point where they cause infection and pain. And people need to ration the money for dental care for pain and infection rather than getting preventative treatment and early intervention. And this results in people losing teeth rather than keeping them. Also, another problem that occurs is that a lot of people end up at their doctor's offices for dental pain because they have nowhere else to go. This is something that still leaves these people needing to be treated by a dentist because doctors aren't trained to treat dental pain. And people are usually just written a prescription for antibiotics and pain medication, which oftentimes takes the form of an opiate. Because people can't go to the dentist, this contributes to 2 problems. For one, misuse of antibiotics increases the likelihood of superbugs forming that are drug resistant to various antibiotics. And the reliance on opiates for dental pain contributes to the opioid overdose crisis that we're facing, where people really they need to be seen by a dentist, and these Band-Aid solutions don't fix the problem. We need to look at how we're currently trying to solve this problem, which governments have some targeted safety net programs for people who they see as struggling the most to access dental care. So mainly people in social services, children, it varies from province to province. But generally speaking, these are very meager programs. It only accounts for 5% of dental spending. And what happens is these programs are so underfunded because they're demonized as people getting free stuff that the fees they pay out are very low. Somebody doing a filling for somebody on social services, a dentist might get paid, say, half of what they would get paid for with somebody working on a private plan. So the people on the private plan kind of have a fast lane for accessing dental care, whereas the people in social services have a slow lane because their fee guide pays out a lower amount. And a lot of dentists just won't take people on these plans for that reason. This is something I experienced firsthand, seeing people who won't accept people on social services, which is very frustrating, but is kind of because dental care is structured this way, it's inevitable that these problems happen. Also, they pay out low fees, but they also cover very few services. So oftentimes they won't even cover fillings. They'll lean more towards extractions much more heavily than actually trying to save teeth. The current safety net we have in place is completely inadequate. Another trend I wanted to talk about in dental care too is the rise of what's known as corporate dentistry. So there's been a lot of dental offices being bought up by large financial firms or groups of dentists kind of getting together to buy a large amount of dental practices in order to make them a for-profit generating machine for people who don't actually work in the dental clinic. And this is a big problem. And one of the reasons why this is happening is because there's a large number of older dentists who are retiring and looking to sell their practices, whereas younger graduates are graduating with so much debt that the thought of taking out a new loan to buy a dental practice it's inconceivable. So these big financial firms are stepping in to buy up these dental practices and hire people to work in them for them, really just to make them revenue. So this is not what we want healthcare to look like in Canada. And it's something that it's very little known about this because there's very little information released. Dental offices are bought up and there's no public notice saying that this has been bought up by a dental firm. They don't advertise these things. And because these dental practices are solely looked at as revenue generating machines, there's certain driving forces that this puts on the practices. And I think a segment from the CBC Marketplace did a good job at highlighting these forces in play. And what the headline of it was dentists vary widely on diagnosis and cost. What this person did was they went to 20 different dental offices and they found they got a lot of different dental plans, varying from people saying you needed root canals when you didn't, or they diagnosed cavities that weren't there in the baseline treatment plan. And these are all forces in place because dental care is viewed as a profit-generating machine. And the more procedures you do, the more fillings you do, the more money you're making as a dentist, but also the more money you're making for the corporation that owns the dental clinic. And that's really all they see is the bottom line. They're not healthcare providers that know how many cavities people need, but if you hire somebody who is more willing to push those boundaries, you are viewed as more beneficial to the corporation because you make them more money. Because of these problems that I've been talking about so far is why I founded the group Coalition for Dental Care, and in the hopes of building momentum to push for a more humane alternative for what dental care can look like in Canada. In its simplest terms, we want you to use your health card, not your credit card, to access dental care. So our vision for universal dental care has a few main components. So there's three main components and kind of smaller points to put here and there. But the first is that we want everyone to have dental insurance throughout their entire life. We don't want people to worry about losing dental insurance when they become unemployed, when they retire, or even if you rely on your significant other's dental insurance through their work and you leave because it's an abusive relationship. You shouldn't have to rely on their benefits for basic health care. Also, just because you have dental insurance does not mean you necessarily have a dental provider nearby. So the second pillar of our plan is public ownership of some dental clinics. This can help treat the populations who currently lack access to dental care more efficiently. So we want publicly owned dental clinics in community health centers in poor and rural communities, but also places like schools, long-term care facilities, prisons, and I'm sure there's many other places as well. What public ownership allows us to do is also change the nature of dental care delivery. So we can have salaried providers rather than people working on a fee-for-service, which eliminates that incentive for overtreatment and also helps dentists who want to treat more difficult populations. And if you're treating on a fee-for-service basis, you're actually disincentivizing those providers from treating those other communities that you have to put more time per unit of service. So having salaried providers in this respect eliminates the incentive for overtreatments and also helps dentists put the time and energy needed to help these communities. And when I say dentists, we need to also keep in mind public ownership lets us break dentist monopoly on dental care, and we can reinstate what are known as dental therapists and make them mainstream in Canada. Dental therapists are mid-level dental providers that perform simple procedures like routine fillings, simple extractions, all at a fraction of the costs of a dentist. And there used to be a dental plan in Saskatchewan in the 1970s and 80s that used dental therapists in school-based clinics, and it was wildly successful. Over its 10-15 years of operating before it was privatized, the need for fillings and extractions in children's teeth went down by half because dental care was much more accessible and people were getting early intervention and treatment. This is needed not just in schools, but really across the board. We need to break dentist monopoly on care by making dental therapists mainstream in Canada. It makes our tax dollars go much further, because if a dentist wants to do a filling and demands $200, $250 for a filling, whereas if we do it with a dental therapist, you might only have to pay $80. You could imagine your tax dollars go much further with the dental therapist doing that routine work and leaving dentists to focus on more complex procedures like root canals and crown and bridge work. This is our vision for universal dental plan. There's other things that are needed other than these three pillars, like government regulation to oversee overtreatment. Also, the federal government could set up a crown corporation to buy equipment and dental supplies in bulk to lower the costs, which is a big area of cost savings. If you're interested in learning more, please check us out on Facebook, Instagram, or Twitter, or reach out to the group. And if anyone's interested, we'd be happy to have the help.